In this podcast, we'll continue with musculoskeletal injuries from Chapter 20. And we'll look at common musculoskeletal injuries. Essentially, we want to associate structures in the musculoskeletal system with a particular injury that can occur. Now, we may talk about a zone of injury, and that zone of injury includes the obvious injury, damage to a particular structure, and then any associated area that may be damaged as well. Now, the size of that zone of injury simply depends on the amount of force that was incurred. The first common musculoskeletal injury is a sprain. That's stretching or tearing of a ligament, and that may be minor, such as a minor sprain rolling an ankle while playing basketball. That could heal pretty quickly, or it could be pretty major. In that case, we might describe it as a torn ligament. Think about tearing an ACL in your knee while skiing. Now, we want to contrast that. It sounds very similar, but it's different. A strain is a stretched or torn muscle. We call it a pulled muscle. Maybe that's poor body mechanics, and it's a mild strain because of improper lifting. You strain the muscles in your back. It may be a more major strain, such as if you've ever pulled a hamstring. It's quite painful, and it can take a long time to heal. In the skeletal system specifically, a broken bone is described as a fracture. Now, that may be closed. In a closed fracture, the overlying skin surface is still intact. It may be open, where we have sharp ends of the broken bone protruding through the skin. And we have to be careful in treatment because that is open to infection. Classifying fractures can happen in two ways. The first refers to just anatomic alignment. A non-displaced fracture is one in which the bone ends typically stay in line, and a displaced fracture is what we see here, where the bone ends are no longer in normal alignment, and we see the bend or the crookedness of this patient's lower leg. Additionally, we can classify fractures on the shape of the fracture line. Transverse simply means across. Oblique means at an angle. A comminuted fracture is one in which we have small bone fragments associated. A green stick fracture is common in pediatric patients. It's a bend but not quite break sort of a fracture. And a compression fracture, again, as the name describes, imagine falling from a height and jarring your back so strongly that we end up with a compression fracture in the vertebrae, as shown here. If we consider joints where bone ends come together for movement, we can have a dislocation. Now, in that case, the joint capsule, and the synovium and the synovial fluid there and the surrounding ligaments could be stretched or torn as well. We can imagine the displacement that would occur. But if that joint only partially dislocates and returns, we have a term for that, and that is subluxation. Let's summarize. In the column on the left, we have common structures: bones, tendons, ligaments, joints, and muscles. Each one of those has a particular function, and associated with those are the injuries: bones, fracture; tendons, rupture; ligaments, sprain or tear; joints can dislocate; and muscles can strain.